My name is Cheryl Cook. I'm the board president of the Lois Price Spratlen Foundation, and I'd like to welcome you to our 2021 annual gala. Our theme this year is partnering for solutions. As nursing has taught us, partner has many definitions and can encompass many people and populations. Some of our partners are schools and colleges of nursing. Some are community groups supporting people with mental illness. Some partners are donors who provide gifts that keep the foundation solvent, and some are volunteers who generously give of their time and their support. Finally, as psychiatric nurse practitioners, our most important partners are our clients and their families. We fully recognize that we cannot provide excellent mental health care alone, that partners are essential members of the communities we serve. We cast our net wide for partners, and we welcome them gratefully in our effort to provide support to students seeking to join our ranks. This afternoon, I'm very grateful to have you all here, and I'd especially like to welcome a few special guests. First, I'd like to welcome members of the Spratlen family. Patricia Spratlen Etem, Pamela Spratlen, Townsend Price Spratlen, Paula Spratlen Mitchell, and Kalfani Malamba. I'd also like to welcome our keynote speaker. I'm very grateful she's here today. And that's Dr. and Chancellor Sheila Edwards Lange from the University of Washington Tacoma. I'd like to also recognize Ms. Frankie Manning, who is a wonderful member of our Seattle nursing community and a leader, and we're grateful she's here with us today. Dean of Nursing at Seattle Central College, Dr. Vicki Hertig, is here. And if she's not, she'll be arriving soon. Oh, there she is, I see her. Dean Emeritus of the University of Washington School of Nursing, Dr. Nancy Woods is here. I believe Butch DeCastro, who's the Director of Diversity, Equity, and Inclusion at the University of Washington School of Nursing, is also here. There's Butch, I see you. Thank you all for being here today. I'd also like to thank our sponsors. This year we have fantastic sponsors, and I'm so grateful. Nassim and Nick Peach and Floss General and Cosmetic Dentistry. We have nominated them as heroes for their contribution to the foundation this year. Our champions at Seattle Children's, our supporters, the Seattle University College of Nursing, Dr. Nina Ramsey, Miss Bonita Giros Cantu, and Miss Nikki Boehner. And we have many friends of the foundation. I mean, we have so many friends, it makes it too numerous to mention everyone, but we are grateful to each and every one of you for your support, and we thank you. The Lois Price Spratlen Foundation was formed in 2014 as a nonprofit 501c3. Previously, scholarships were given through the Association of Advanced Practice Psychiatric Nurses. It is fitting that this foundation be named for Dr. Lois Price Spratlen, professor and former ombudswoman at the University of Washington. Dr. Price Spratlen was a psychiatric nurse practitioner who was committed to education and social justice, and she stressed the importance of going beyond our perceived abilities to achieve what is possible. Lois encouraged psychiatric nurses and nurse practitioners to share our expertise with one another. She fostered the education of nurses by nurses and envisioned building knowledge within our profession. She was a model of excellence in advanced practice nursing and an inspiration for generations of nurses to follow. Another very important member of the family was her husband, Dr. Thaddeus H. Spratlen, who passed away this summer. Dr. Spratlen was professor emeritus at the University of Washington's Foster School of Business. Dr. Spratlen's individual contributions to society are just remarkable. And as a foundation, we've benefited greatly from the support Dr. Thaddeus Spratlen gave to his wife, Lois Price Spratlen. And after her passing, he was instrumental in carrying on her mission to educate and support psychiatric nurse practitioners. Over the past 7 years, the foundation has provided 15 scholarships and 2 community grants. None of this would have been possible without the Spratlens. Their wisdom, their vision, and grace were drivers in the continued work of this foundation, and we miss them greatly. With the passing of Dr. Thaddeus Spratlen, whose life we celebrated about a month ago, the fight for right and overwhelming generosity of spirit that the Dr. Spratlen exhibited. Because of this, many others have opened their hearts and their pocketbooks to give to the foundation this year. I'm grateful for the generosity of all who were able to give and for the gift of spirit and support of those who may not have been able to at this time. As a result of these gifts, we were able to provide 3 additional scholarships this year, as well as a community grant. Your gifts mean that 7 psychiatric nurse practitioner students are closer to completing their programs, are experiencing less financial stress as they study, and are able to use their awards to keep themselves on track in their studies. In terms of the community grant, your gifts are helping lay the foundation for students at Seattle Central College who have yet to become nurses. And for all this, we thank you, and we're most grateful. Our guest speaker today is a wonderful academic and leader in the Seattle area. Chancellor Sheila Edwards Lange was born in a small town of Pachuta, Mississippi, and as a first-generation college student, received a bachelor's degree in social ecology from the University of California at Irvine. She earned a doctorate of educational leadership and policy studies and a master of public administration from the University of Washington, Seattle. From 2007 to 2015, Dr. Lange served as Vice President and Vice Provost for Minority Affairs and Diversity at UW Seattle. In that role, she led the creation of UW's first diversity blueprint and spearheaded the incorporation of diversity, equity, and inclusion goals in the UW's response to the Great Recession, which was titled 2 Years to 2 Decades, and it was a strategic planning effort. Prior to her appointment at UW Tacoma, Dr. Lange served as the president of Seattle Central College. Under her leadership, Seattle Central strengthened relationships with community partners to create new academic programs, broaden equity and inclusion initiatives, and enhance student support services to better promote student success. She played a key role in the establishment of the Seattle Promise partnership with the city of Seattle to provide 2 years of free tuition to graduates of Seattle public schools. And that in and of itself is a massive achievement. Her talk today is entitled, Now is the Time, Advancing Inclusive Excellence in Nursing. And it is my great honor today to have her with us this afternoon. Dr. Lange.
Thank you, Cheryl. Thank you for the introduction, and thank you for inviting me to speak with you today. Can you all hear me? I'm okay, just, I'm a little nervous about power going out today, so I'm going to try and make sure that I speak loudly and focus before my power goes out. I'm really honored to be here with you today, especially since I had the privilege of working with both Lois and Thad. They were both very generous in their encouragement and support of me as a young graduate student when I first arrived at the University of Washington in the 80s. And then later on, when I became the Vice President for Minority Affairs and Diversity, just really strong partners and supporters and collaborators. So I know that today is really about celebrating our students and the awards program. So I'm going to try and be brief. I want to share a little bit about UW-Tacoma, because that's what, college presidents and chancellors, we have to tell you how wonderful our institutions are. But then I want to talk a little bit about why I think that time is right for the work that the foundation is doing to expand the number and the diversity of advanced practice psychiatric nurses. And then based on my experience, the 3 lessons that I've learned that I think can help us as we are thinking about this vision of expanded mental health service in rural and underserved communities. And when I agreed to speak with you all, I was still the president at Seattle Central College. So I just moved over to Tacoma last month. Both institutions have great nursing programs, and I'm so glad to see our dean, Vicki Hertig from Seattle Central on this call. Both of the nursing programs at UW-T and Central pride themselves on the diversity in their student body, but they're always pushing themselves to do more. At UW-T, we have 5,000 students on our campus, and more than 1/3 of our nursing students are underrepresented minorities. In fact, last year we established a Rosa Franklin Nursing Student Endowed Support Fund to provide financial support to RN, BSN students and graduate nursing students, with a strong preference for students who were interested in diversity, equity, and inclusion and social justice issues. The UW-T program offers the RN to BSN. We offer a Bachelor of Arts in Healthcare Leadership and a Master of Nursing degree. Our program is affiliated with the nursing program on the Seattle campus and is accredited by the Commission on Collegiate Nursing Education. So having said that, why do I think that the time is right for this work that the foundation is doing right now? Really 3 main reasons. One is that demographic change that we have been saying is coming for the last 30 years is here. And we have many of our counties, including King County, which are minority majority. So folks of color are increasingly the majority of the population. And so starting back in the 80s, we had so many reports talking about, this demographic change is going to come. We got to make sure that we are prepared to serve this demographic change. And we needed to change every profession from engineering to business to nursing. And so there have been a number of reports about the need to change the profession. The second reason is COVID. I mean, we're in the middle of a pandemic that has changed everything, particularly mental health and healthcare services. And COVID has really increased the mental health needs in our community. According to the National Institute of Mental Health, we know from research on disasters that after a disaster, we can expect large numbers of people reporting distress, including depression, anxiety, insomnia. And what we are seeing now is much worse than what we would have even expected after this kind of traumatic event. There have been several surveys, including those from the Centers for Disease Control, which have shown just unprecedented increases in behavioral health symptoms. According to one CDC report from June of last year, 31%, like 1/3, reported symptoms of anxiety or depression. 13% reported increased substance use. 26% reported stress-related symptoms, and 11% reported having serious thoughts of suicide in the past 30 days. And these numbers are more than double what we would have expected before the pandemic. And what we know from prior research is that in underserved communities, rural communities, communities of color, that mental health, there's still stigma about seeking help for mental health. So we have this just dramatic increase in need due to COVID, and we need more mental health professions, and we need more mental health services that are culturally relevant and responsive. And as if the pandemic were not enough, We also have a racial reckoning going on in our country right now after the murder of George Floyd. And we're now having a lot of conversation about the need for us to change how we respond to mental health crises, particularly in communities of color. There's a lot of conversation about, defunding the police and changing that funding to put it into more mental health professionals who actually respond to people in crisis rather than folks with guns. And that is so relevant in communities of color. So, Martin Luther King said that the time is always right to do the right thing. And if we didn't think that the time was right, those three things alone, the changing demographics are here, the mental health needs that have been exacerbated by COVID, and then just this racial reckoning and the changing in how we are responding to mental health crisis in communities of color. So if we're going to do the right thing, how are we going to get there? There are three things that I've learned from my work, first as a campus diversity officer, and then as a college president who is focused on trying to lead with racial equity. The first thing that I've learned is we have to change everything if we want a different outcome. Doing the same thing over and over again and expecting a different outcome, we are destined to fail. Organizations that say they want more inclusive students, faculty, or outcomes, we've got to change. In nursing, particularly psychiatric nursing, you're going to have to change the way that we communicate about the field to focus on its relevancy, to communities of color. We have to talk about the disproportionate impact of mental health in communities of color and how the field can actually help us address that. We know from research on equity, particularly in trying to get students into underserved fields, that those students are more likely to choose fields of study where they think they can make a difference in their community. So changing, one of the things we're going to have to change is how we communicate with prospective students. The other is changing where we go for those prospective students. So I think it's Wayne Gretzky. We just had I've got hockey on the mind, but I think it was Wayne Gretzky who said, you have to skate to where the puck is. And if we want more racial diversity in faculty and students, we cannot continue to recruit at the same places if we want to grow the graduate population of students of color. We can't go to institutions where there are very few students of color or where they don't have good track records of producing students of color. So in nursing, that means where are the RS to BSN programs that are producing students of color that you can recruit from? And what kind of relationships do we have with them? Authentic relationships. Part of changing everything also means looking critically at the field and asking hard questions about how inclusive is nursing really? To that end, I see Butch DeCastro on the call, and the UW School of Nursing is now establishing a center for anti-racism in nursing. And it's in the process, I think, of holding listening sessions to help the center develop its scope and priorities. Part of what I understand it's going to do is cultivate anti-racist teaching practice, promote community-driven partnered research, support students, underrepresented students and historically excluded groups, and then apply anti-racist principles to clinical practice. That is changing everything. This work is long overdue, but I think that this is a great example of how we in the field can actually move forward with changing everything. The second lesson I've learned from my work leading with racial equity is you have to play the long game. You can't, this is not going to happen overnight. It's taken us hundreds of years, if you think about it, to get to this place, and getting to more inclusive excellence is not going to happen overnight. And we're going to have to develop long-term relationships. We're going to have to start recruiting early as elementary, talking about the field and communicating about it in a way that excites young people. And then thinking about even growing your own. And one of the things that I did at Seattle Central was partner with Seattle Public Schools to begin to identify students in high school who wanted to be teachers, and actually establishing sort of an apprenticeship. So those students are earning while they are learning early. And, they still have to get through high school. They still have to get through the 2-year program at Seattle Central. They still have to go and get a bachelor's degree and then get the master's degree. But really, it's playing the long game, starting early, getting them acclimated to the field, and getting them those relationships with others who are doing the work, connecting them with mentors, starting that work early on. And as I was preparing for this talk, I realized that a lot of people, we know about nursing, and if you talk to people, they'll say they want to be a nurse, but many people, including me, didn't know what advanced practice psychiatric nursing is. I just didn't know until I got connected. So we actually have to start talking about this early and getting folks to know what it is. So the third lesson I've learned is partnering with those who share a common goal. And that's the theme for today. Even though sometimes, the work of doing equity work can feel lonely. I know from having been 9 years as a chief diversity officer. Sometimes I felt like I was the only one who really cared about racial equity and inclusion. But in fact, there was a whole network of community members, organizations, and programs who also care about this work. And having come most recently from the community and technical college world, I can tell you that there is a strong potential partnership there throughout the state. The State Board for Community and Technical Colleges adopted a mission statement that boldly claims that the system leads with racial equity. And all of the colleges are working locally to determine how best to make that mission of leading with racial equity real. Those that have nursing programs like Seattle Central and others are ideal for partnerships. There are also a number of community-based organizations like Mary Mahoney, and I see Frankie Manny on here, who has just been a champion for this work for such a long time. Organizations like Mary Mahoney, community-based organizations that work with young people who are interested in healthcare, are ideal for partnerships. There are also groups like the Washington Therapy Fund and NAMI, which is the National Association of Mental Health, and they have local chapters. We were working with them at Seattle Central to get more of our students connected to mental health services. And these organizations are focused on broadening access to mental health in underserved communities. So they're also really great opportunities for partnership. So as I think about, the work that you all are doing, the work that the foundation is doing, carrying on that legacy of Lois Price Spratlen, I'll tell you just an aside story, and going off script now. My aunt was one of the first African-American nurses in Alabama, and she's 95 now. And I was telling Lois about her as Lois was writing her book. And that book has become the gift that I give anybody who wants to become a nurse, because it is such an incredible legacy of nursing in the Seattle area. And I also had Lois, before she passed, sign a copy, and I sent it to my aunt as a gift, and she was so grateful to get that book. So I love the work that this foundation is doing. We know that there is much more work to be done. And as I said, we know that we cannot keep doing this work in the same old way. We cannot keep talking about equity as though we have to somehow compromise on excellence or somehow lower our standards. We know we cannot achieve excellence until we do more to actually advance equity. We need different perspectives at the table. We need everyone to be working in tandem to eliminate health disparities in our community. And we know from decades of research that diverse teams are better at solving complex problems and issues. And as I mentioned, now is the time, because we have some complex issues in our community, especially related to mental health, that need to be solved. We know better, so now is the time to do better. Thank you so much for having me today.
Why don't we all unmute for just a moment and give Chancellor Lange a hand? I'm delighted that, thank you so much. Thank you very much for your talk today. I took away the focus on building long-term relationships. Going to places where students of color live and learn, helping students earn while they learn, which is a wonderful idea. And then partnering with people to meet a shared goal. I love the working in tandem and working with diverse teams because we know those things work. Thank you very much. We're very grateful for you to be here today. Next, I was planning on introducing Dr. Jeffrey Ramirez, who is from Gonzaga University, but unfortunately, he is seeing patients and is unable to, he had an emergency patient come in, and so he's unable to join us today. In his stead, my colleague, Dr. Elaine Walsh, will be introducing our scholarship awards and telling you a little bit about each of the scholars. And we will hear from the scholars themselves, as well as have the scholars join us eventually in some breakout rooms. So Elaine is associate professor at the University of Washington School of Nursing, and she also is a liaison professor at Children's Seattle. So Elaine, really excited to hear from you and to hear about the students.
Thanks so much, Cheryl. Something has gone wacky with my computer, so I've now logged on with my phone. And can you just give me a thumbs up if you can hear me? Because I can see you. Okay, fantastic. Thank you. Anything that can go wrong will go wrong, apparently technologically. I also just want to express my appreciation to Dr. Edwards Lange, such an inspiration. My honor is to, first of all, thank the scholarship committee. I was a member, and I was joined by my colleagues Janice DeSocio, Jeff Ramirez, Jean Tang, and Ann Mason. And my distinct honor, this is why we're here. We want to talk about some scholars, and you're going to get to hear from them as well. They're in programs of study leading to the psychiatric mental health nurse practitioner degree credential. And they're studying to become leaders in psychiatric mental health nursing with the goal of impacting policies to transform our mental health systems so that they are more diverse and equitable in the services provided among some of the most vulnerable communities in need. So what I'm going to do is introduce each scholar, and they will have about 2 minutes, and we're going to try to hold them to that so that we finish up at a reasonable hour, because they could go on and on with their accomplishments, as could I. But we're going to keep it short, and there will be more time during the breakout sessions for more in-depth discussions with these remarkable people. So scholars, I'm going to pronounce your names. I'm going to say a little bit briefly from your biography, and then I'm going to turn things over to you one at a time. If I do anything in terms of mispronouncing names, please correct me. I'm hoping I've got this right. So I'd like to start first with our Spratlen Family Scholar of Promise, Alicia Sega. Alicia is currently a doctoral student at Seattle University, and she desires to learn how to be an impactful servant leader in mental health for the Black community through her doctoral studies and ultimately working with pediatric populations, specifically in communities of color that are underserved. So congratulations, Alicia, and please take the floor.
Hi, thank you all. I'm very grateful to be a recipient of this award alongside peers who are eager to change the way people view mental illness and how they treat it. This award is giving me the opportunity to build relationships with like-minded individuals. And I'm especially grateful to have the support of an organization that uplifts the voices of women of color in psychiatric nursing. So thank you.
Thank you so much, Alicia. I'm applauding. You can't see me, but I'm there applauding. We're going to now discuss or talk about our scholarship, the rest of our scholarship recipients, and we'll just go through these names alphabetically. Holly Brzezinski. Holly is currently a doctoral student at the University of Washington. She was first inspired to work in advanced practice psychiatric nursing when she saw the challenges patients face to access mental health care in the community. Her long-term goal is to work in a community behavioral health setting that supports adults living with complex mental health needs, including chronic mental illness, trauma, and substance use disorders. Congratulations, Holly, and please take it away.
Thank you. So I'm just honored to be chosen for the Lois Price Spratlen Foundation. She truly leaves a monumental legacy. I was so impressed when I read her biography as well. When working in nursing, we're really at the forefront of patient care. It really doesn't take long to hear the patterns and calls for improvement and to find gaps in care. So the decision to pursue graduate school is the determination to answer the calls for change. And I really feel to create greatness in our people, in those that we grow up with, our local communities, that it's crucial to provide the support to others in their times of need. So I chose to pursue nursing to support my community because my mind has so often answered my calls in my great times of need. Becoming a psychiatric nurse practitioner answers the call for providers to meet the shortages in the field of mental health. As a mother of 4 to my children, Anna, Eliza, Emma, and Hobbs, my family, friends, faculty, and classmates have all contributed countless hours of support and encouragement to get me to this point. I've not only sustained my own full-time graduate schoolwork throughout this program, but I've also been juggling my children's schooling throughout the pandemic. So having an award like this is the support and encouragement that I need to meet my goal to become a mental health provider and give back. So thank you so much.
Thanks, Holly, and congratulations again. Our next recipient actually is not able to be with us, but I'm going to tell you a little bit about him. His name is Spencer Hendricks, and he is currently a graduate student at Gonzaga University. His short-term professional goals are to begin practicing in Walla Walla County and to partner with local service agencies in serving community members with mental health needs and limited access to healthcare services. His long-term professional goals are to expand the availability and accessibility of mental health services in Walla Walla County. He's passionate about being a mental health resource for his community and about increasing access and availability of mental health resources. He started nursing as a cancer care nurse, and his experience in that type of nursing really impressed upon him that there was value and meaning in partnering with people in difficult circumstances. He hopes to bring this commitment into his future practice in mental health and into his efforts for expanding mental health services in rural communities. So congratulations, Spencer. I did a little bit longer talk about you since you were not able to be here and wanted to tell people a little about your plans. Our next recipient is Sarah Kim. Sarah is a doctoral student at the University of Washington. Her experiences in mental health settings across the continuum of care have given her keen insight into the systems and institutions through which care is delivered. Seeing the gaps in the mental health system has driven her to make practice improvements by making system changes and increasing the quality of mental health care. She plans to build on the work she has started, continuing to explore ways to improve care for adolescents in inpatient mental health settings. So Sarah, your turn. Congratulations.
Hi. So I currently work in a community mental health clinic where I've seen firsthand how difficult it can be for underserved populations to get access to treatment and how society works against those with mental illness. Our patients are stressed and scared, and many of them don't have adequate resources or social support. And when we show up for work in our clinics and hospitals and schools, we create a space for them where they can feel safe and supported, a place for them to heal and rest. Creating that space takes all of our effort, our time, and our expertise. And all of us know how hard it can be, but we show up every day because we'll stop at nothing to make sure our patients have that space. So we all have the same mission as part of the community of mental health care, and it takes each of our daily efforts and contributions to ensure that the community can continue to exist and thrive. Our community also needs nurse leaders who are knowledgeable, not just about psychiatry and clinical practice, but also about the systemic barriers to access and how to build and promote systems that allow for effective care across the continuity of care. And I want to say that I am so grateful that the Lois Price Spratlen Foundation is investing in our future of becoming psychiatric ARNPs that will contribute to this community. Thank you.
Thanks so much, Sarah, and congratulations. Our next recipient is Soli Lim. Soli is a doctoral student at the University of Washington. She has learned that nurses have a powerful impact on the lives of patients, families, and communities. She has witnessed people with complex mental illnesses, leading her to understand the important role of psychiatric nurses. Her goal is to impact the Korean American communities through education and service. Soli, your turn. Thank you. Congratulations.
Hello, I am genuinely grateful to receive this scholarship, and the Lois Price Spratlen Foundation is really meaningful to me because it's a group of experienced mental health nurses, nurse practitioners, and nurse leaders who have paved the way that I'm currently walking on. I have a clear vision to serve an Asian American population with mental health needs, acting as the bridge to break the negative stigma that clearly exists and provide the necessary care and educations to the community. Again, I am honored to be now part of your foundation, and your generosity has made me one step closer to completing my vision. I hope that one day I'll be able to help other students achieve their educational goals as you have helped me to further shape this community in a positive way. Thank you so much.
Thank you, Soli. Congratulations. Our next recipient is Amber Spencer. Amber is a doctoral student at Pacific Lutheran University. Throughout her career in the emergency department, she witnessed a lack of mental health resources in her community. She observed that inadequate mental health resources resulted in unacceptable patient care, increased healthcare disparities, and poor outcomes for patients suffering from mental illness. Amber has a passion for the mental health of homeless youth, driving her to make practice changes to improve care of this population. Her long-term goals are to provide psychiatric care in an integrated community mental health model, where she can help reduce mental health disparities by increasing access to mental health providers. Amber, congratulations.
Thank you so much. I am a third-year DNP student at Pacific Lutheran University. I graduated from nursing school in 2013 and began my nursing career in Baltimore, working in an inner city emergency department. And I've gone on to spend my entire nursing career in emergency medicine. My experience as an ER nurse really opened my eyes to the unmet needs of patients suffering from mental illnesses, substance use disorders, and homelessness. These experiences ultimately drove me to pursue a career as an advanced practice psychiatric nurse so that I can better serve my community by addressing these areas through prevention and early interventions. I'm so grateful to be one of the scholarship recipients this year, as this award will really fund my time working on my DNP project. The goal of my project is to increase mental health service utilization using motivational interviewing in the population of homeless youth. Youth who have experienced homelessness have high levels of trauma and adverse childhood experiences, which really heighten their risk of developing PTSD and other very severe mental illnesses. Therefore, there's really a critical need for mental health interventions in this population. Receiving this scholarship is one of the ways that I can continue to afford to be a full-time student and address some of the access barriers faced by youth. This gives me time that I need to develop and implement a mental health intervention for homeless youth, an underserved population in dire need of our help. I would like to thank the scholarship committee for selecting me for this award, and I hope that I honor the profession's commitment to the legacy of Lois.
Thank you so much, Amber, and congratulations again. Last but definitely not least, Linda Trader. Linda is a doctoral student at Pacific Lutheran University. As an emergency department nurse, she identified the lack of mental health care in populations from underserved communities who are most impacted by social determinants of health, contributing to poor health outcomes. She hopes to share her personal experiences as a first-generation college student and passion for helping others through mentorship, advocacy, and advancement of the professional nursing role. After graduation, her goal is to increase access to care for underserved communities. Congratulations, Linda, and the floor is yours.
Thank you so much. I would like to express my gratitude for being a recipient of this award. As a non-traditional student in every aspect of being non-traditional, I am very hopeful for my future and for the future of the profession. As a person of color in an advanced practice role, I hope to mentor others, and I also hope to use my passion as well as increase the passion of others to change the lives positively for our community. Thank you very much.
Thanks so much, Linda. So we are extremely proud of our 7 recipients and are so glad that we had 6 of you available to be here today. We look forward to hearing about your progress and welcome to our family. Congratulations again. Maybe we can unmute and applaud our fine group of scholars.
I believe next we are, Pat, I want to just make sure of this and that you're still with us. I know you have some blinking lights going on at your home.
Yep, I'm still here.
Okay, so I'd like to introduce our executive director, Pat McGowan. She's been fantastic for the foundation. She has really helped us kind of really get our lives together here as a foundation this year. And I'm so grateful that she's worked with us. She's going to introduce the community grant and Dean Hurtig. Pat?
Yeah, thank you so much for the kind introduction, Cheryl. And thank you everyone for joining us today. I think that we're seeing several people who are holding out, and we think someone up above is watching out for us because so far the power is holding. Now I may have just jinxed it, but thank you. And I want to also mention that your tremendous support, and especially an anonymous contributor this year, allowed us to give more scholarships than we usually do. For those of you who have been with us for quite some time, you know that we generally only give 3, and I know that was shared earlier, but I just want to re-emphasize that we're very delighted that we're able to help so many students this year. So thank you very much for your support. And now I have the distinct pleasure of announcing this year's community grant. In a moment, you're going to be hearing from Seattle Central College School of Nursing Dean Vicki Hurtig. But first, let me share a little bit more about our community grant program and why we've chosen Seattle Central College Nursing Program as this year's recipient. The Lois Price Spratlen Foundation Community Grant Program was created to support a project that brings mental health services to communities in Washington State. Community health centers, rural counties, and underserved communities struggle to find qualified mental health providers. While speaking with our prior scholarship recipients and during this year's scholarship application process, we were reminded how challenging it is for students to work full-time, take care of families, and complete their education. We decided to seek a partner who we believe will help create more diversity in the Washington State Advanced Practice Psychiatric Nursing programs. As Chancellor Lange so clearly said, you know, maybe we're going to go where the puck is. And so on behalf of the Lois Price Spratlen Foundation, I'm proud to announce that this year's community grant recipient is the nursing program at Seattle Central College. Dean Hurtig, would you like to say a few words?
I would love to. Thank you, Pat. Good afternoon, everyone. And first of all, I want to say congratulations to all the scholarship recipients it's very exciting to hear, to see you and hear of your plans. So that's really very cool. So I appreciate so very much the opportunity to represent Seattle Central College. And Pat, thank you so much, because it was just a delight to meet you earlier this week. And so just a couple of comments about the community grant and how much I appreciate and am grateful for that. We have an incredible group of students at Seattle Central College, and we not only teach at Seattle Central College, but also at North Seattle College and South Seattle College. So we really do encompass the majority of places across Puget Sound. Our current student body, and this has held true for quite a while, is 56% students of color. So we do have, and we're very proud, and we work hard to make sure that we're presenting a program and allowing a holistic admission process where we can get students in through the program and then out there to do the work that's so needed in the nursing profession. So I have been just beginning to talk with the students about how to use this grant monies. And one of the things that I had mentioned when I was first talking with Pat is that setting up 2 ideas came to mind immediately, and we're probably going to pursue those, but be open to some other ideas as well. And that is setting up a mentor program. I'm looking at the current scholarship recipients who I know are very busy, and yet the ability to be a mentor for our students is priceless. Okay, they want to see themselves in these roles, and we do have students who are interested in psychiatric nursing, and unfortunately we do expose them to that, but not enough in my mind. Correct, we don't have enough experiences to, we're working on that, but the opportunity that this grant would provide to make sure that we can hook up those folks who are very interested with a mentor in the field is going to go, I think, a long way. So that's something that we're thinking about and excited about. The other thing is we have a very active student nursing association within our nursing program, and they're constantly looking for speakers to come in and speak to their student group. And even throughout COVID, we've had a very good, robust participation in our student nursing association, and a really robust participation by the community in terms of trying to expose them and talk to them about some of the potential opportunities in nursing. So those are the 2 ideas that I have. All of it is grounded in this, coming to this meeting, and I've not been to one before. It is so empowering and just so uplifting. I needed this. Thank you for inviting me. Thank you for giving us the scholarship, or the recipient, the community grant. I'm sorry, but I'm real excited to be able to expose our students to the world of opportunities and the world of need in psychiatric nursing. So thank you again for choosing us. I want to thank Dr. Edwards Lange for, I guess when she accepted this invite, she was still president of our institution. And while we wish her well, we miss her very much already. So, but I'm appreciative for her for keeping us in mind, and love to set up partnerships with this foundation. And I see a lot of folks that I've worked with in the past. I am a graduate from the University of Washington, and I've taught there. And so I've just, it's so good to see a lot of familiar faces on this call. So thank you again. We will keep you posted. We want to be active, productive partners with this community grant. So I will be in touch. That is my style. And I want to make sure that we can stay true to the intent of the Lois Price Spratlen Foundation. And that is to really make sure that we get our students, and especially students of color, exposed to, interested in, and progressing so that they can be productive mental health practitioners in the future. Thank you very much.
Thank you, Dean Hertig. And let's go ahead and unmute and applaud again. Sorry, I was a little slow on the draw there. Thank you very much. And congratulations. And I do encourage you to reach out to us if you'd like to know more about the program or how we might partner. And I'm sure Dean Hertig will be available as well. So we look forward to hearing more in the future, and that we see some great mentorship and partnerships happening. So I want to share now, in light of all the great work and the so much more work to be done that we've been hearing about today, I want to sit back for a minute in reflecting and think about all of the great strides that the foundation has made, especially during its early years. As of today, we've now awarded 22 scholarships and 2 community grants. So like Dr. Lois Price Spratlen, we've contacted you and we've said, here's what I need you to do. And you've responded by providing your generous support. And that's why we've been able to do all of this. And I also want to take a moment to show our gratitude to Connie and Charlie Huffheim for their generous $5,000 challenge to kick off our gala. So if we could please give them a big round of applause right now. So greatly appreciated for doing that. And I'm thrilled to announce that you definitely rose up to that challenge. And you not only met the challenge, but you exceeded the goal they set. So we're so happy and pleased to see that and very grateful for your support. Again, all of the support is why we were able to award 7 scholarships this year instead of the 3. But we've also heard today that we're being called to action. We're being called to partner for solutions for the lack of access to mental health care and for diversity of our advanced practice psychiatric nursing profession. So today you've seen how the Lois Price Spratlen Foundation is partnering with individuals and organizations to be part of the solution. And you've been asked to seek opportunities for partnership. Well, I have another announcement. Early this morning, I received a message from longtime supporters, Mary Ann Murray, Dave Cundiff, Mary Ellen O'Keefe, and Marie Eaton, who believe so much in the importance of our work. They want to see even more people invest in our purpose. They're really taking the heart of partnering. So they've issued a new fundraising challenge in honor of the values of the foundation's visionaries, Lois and Thaddeus Spratlen, and as a gesture of support to our scholars. They are sharing that they will match dollar for dollar up to $3,000 in contributions from new donors who contribute before the end of the year. As you may know, the funds we raise to the end of the year will determine how many scholarships and how much community support we can provide in 2022. You've demonstrated that you're willing to rise to the challenge through your support of the foundation and this gala. We're asking you not to let up. Help us meet the new challenge issued today, both by Chancellor Sheila Edwards Lange and our challenge donors. Help us bring more people into the foundation and support the mission that we so greatly have been working to realize and been seeing in action today. I know you can do it. You've done it in the past, and I have no doubt we'll be able to meet this and share some good news with you in the future. So now, in a few minutes, we're going to go into the breakout rooms with our scholarship recipients and foundation board members. I'm sure you're going to be reminded not only of the difficulties you encountered as a student, but also the significance of community support in launching your careers. We hope that before you leave today or over the next couple of weeks, you'll support us in our mission of identifying, encouraging, and cultivating excellence in advanced practice nursing. Welcome back. Well, it sounds like you had some delightful conversations and hopefully connections made and continued conversations. I'd like to invite any members of the Spratlen family before we leave. If you want to unmute and say anything, we would love to hear from you.
Hi, this is Patricia Spratlen Eaton, and I just want to congratulate the foundation and the scholarship recipients. Thank you so much for the format of this particular event, and it was very informative to participate in the breakout sessions as well. I look forward to following up with the breakout session members that I was a part of to, provide any additional resources that I'm aware of to advance the partnership work. So congratulations around the table.
Thank you.
I don't know if Kalfani is still here on the Zoom or not, but this is Pamela Spratlen. I just want to thank everyone associated with today's event for lifting up the legacy of Dr. Lois Price Spratlen in such a powerful way. I'm always, we always thought of Mother as our mother, but in all of the events that we've been part of, certainly that I've been part of recently, and certainly this one today, it's very clear that she continues to make a systemic impact on the nursing profession, which was definitely her wish in Washington State. It was very exciting to hear the presentations, hear the biographies of the winners. That you were able to do 7 instead of 3 is truly remarkable. I very much appreciated also the attention to partnership and the importance of both individual effort through the scholarship program and the community grant. And I think giving it to a community college at this time when community colleges are very much on the national agenda and nursing is so much in the spotlight because of COVID-19, as we heard from your keynote speaker. I think it's all very powerful that you were able to connect so many dots through this event today and through the work of the foundation throughout the years. So thanks to the people giving the challenge grants. That's just another awesome indication of the degree of support and love for Mother and her work. And thanks to all of the staff, board, everyone on the foundation, associated with the foundation, for all that you are doing. It is making a difference throughout the entire state, touching so many different parts of Washington State's population, and your continued focus on students of color is extremely heartwarming. So I just wish you all the very best, and thank you very much for the opportunity to participate and to interact with the winners. That's not something I've seen before at an event, and it makes an enormous difference to be able to get that personal connection with the people who are receiving funds that are going to make a big difference in doing so many of the things that Mother would have wanted to see advanced. So thank you all very much. And I certainly appreciate all that you're going to continue to do to make these winners successful and to keep the program going. Over.
Thank you so very much. It's an honor to continue our work and to have you all here today. Kalfani, did you want to say anything?
Well, when words are said well and cannot be improved upon, I think it's best to say hear, hear.
Perfect. Thank you. Well, I'm happy to say that we've stayed right on time. So thank you very much for all your support, and thank you to all our scholars for participating today. And we look forward to having more conversations with you, as well as with our community grant recipient. And thank you for joining us, and may you have power the rest of the day and going forward. Thank you.
Thank you very much.
Bye, everyone.
Thank
Goodbye.
you. Thank you so much.
Thank you, everyone.